So the Māori Health Authority, Te Aka Whaiora, was set up about 18 months ago as part of the wider reform of the New Zealand health system. And the primary purpose was to address the health issues of Māori, indigenous Māori people in Aotearoa, New Zealand. Many will know that Māori New Zealanders have had the worst health outcomes in the country. Pretty much all of the health conditions known, diabetes, childhood illnesses, injuries, all manner of things Māori fear worse than non-Māori in New Zealand. And the idea of the Māori Health Authority was that it would be dedicated to addressing those inequities.
So why then is the government getting rid of it and urgently?
Oh, we had an election last year where we had a three-way coalition, three different parties forming the government. And one of the pre-election pledges from the coalition, or at least two of the parties, was to get rid of the Māori Health Authority. They claim that it is a bureaucratic issue, that it's discriminatory, that it favours Māori over others. And so this is them carrying through on that pre-election pledge. The problem, of course, is they're rushing it through with urgency. They say because their 100-day plan expires on the 8th of March and they've got to get it done. There is no emergency to justify bypassing the usual democratic process where New Zealanders can have a say about the repeal and why and what might replace it.
How much opposition is there to this move, both within Parliament and also among the community? What are people saying?
Oh, out in the community, as you can imagine, the indigenous Māori people are pretty much united. You know, this is important because the Māori folk are made up of different tribes, and it's a very rare occasion where they all come together united in a single issue, and this one has brought them together. Those of us in the health sector who've watched the challenges of trying to get good health care to Māori and other New Zealanders, pretty much everyone thinks that it's premature. It's only 18 months old, and the government is saying they'll go back to having the Ministry of Health and existing agencies take over the responsibility, things that we've been doing for decades with not much in the way of improvement. So broadly speaking, there's a lot of cynicism. There's no compelling reason to do this other than politics. That this was an election pledge and they pretty much have to go through with it, I suppose.
Has the coalition government given any details on how they might, their proposals to replace the Māori Health Authority? And do you think it's substantial enough if they have said what their plans are?
Oh, they have said they'll replace it with a unit within Te Whatu Ora, Health New Zealand, the main funder of health services in New Zealand, as well as a unit in the Ministry of Health. The problem is, of course, this has been the arrangements before the Māori Health Authority was introduced, and it didn't seem to have achieved much. That we face chronic, almost entrenched inequalities where Māori people have the worst health outcomes. In other words, what they proposed to replace the Māori Health Authority with is old hat, if you like, things we've done before with not much benefit. That's why the cynicism, that's why the opposition, considerable unhappiness, because most people don't believe that what is being proposed will make any difference.
And in your view, what impact will this move have on Indigenous healthcare and health equity in New Zealand?
Well, coupled with the other big thing they've decided to do in repealing the smoke-free legislation, we think that in fact things will get worse for Māori. Not only it'll stay still, smoking in Māori adults is the highest in our country, and smoking causes all manner of poor health in New Zealand. And with the repeal of the smoke-free legislation, we think that it will actually make matters worse, more heart disease, that kind of thing, because the government claims that they'll continue to put measures in place that will lead to a reduction in smoking. Smoking has come down in New Zealand, not so much among Māori. That's the issue.
Finally, what's your view of the Coalition's overall approach to an impact on public health? What, in your view, needs to change? What needs to be done to improve the situation?
Oh, I'm not very confident that the Coalition government's approach to public health is good for New Zealand. You've heard about going back on world-class smoke-free legislation. They're looking to dismantle an authority dedicated to addressing inequities in indigenous people. They're replacing the workplace bargaining arrangements. We think that will lead to potentially more workplace injuries. So overall, I am not very confident that what the Coalition government is proposing will lead to improvements in the health of New Zealanders.
So Collin Tukuitonga, thank you so much for your time.
Thank you.